Type 2 diabetes is a progressive ailment characterized by the gradual emergence of blood sugar irregularities. It initiates with initial indications of slightly elevated blood sugar, glucose, levels, falling outside the norm but not reaching the diabetes threshold. This initial stage is known as insulin resistance and marks the initial phase of the four-stage progression of type 2 diabetes. In the ensuing sections of this article, we will delve into each stage, elucidating what one can anticipate at every juncture and offering insights on how to effectively manage the condition's progression. Stage 1. Onset of insulin resistance. Insulin resistance serves as the harbinger of blood sugar issues, often manifesting years prior to a formal diagnosis of type 2 diabetes. As you consume food, it metabolizes into sugar, glucose, within your body and enters your bloodstream. In response, the pancreas secretes insulin to facilitate the removal of sugar from your bloodstream, enabling its entry into your cells for energy utilization. However, when your body exhibits resistance to insulin or fails to respond adequately to it, your blood sugar begins to rise. Consequently, your body signals the liver and muscles to store surplus blood sugar. When the liver's capacity is exhausted, the excess sugar is channeled into fat cells, accumulating as body fat. While this initial stage can often go unnoticed, it sets the stage for potential serious health complications in the future. Hyperinsulin resistance. Hyperinsulin resistance, a rare condition, occurs when the body's tissues fail to respond to insulin due to a genetic mutation affecting insulin absorption by cells. Stage 2. Prediabetes. Prediabetes denotes a condition in which your blood glucose levels fall beyond the normal range but remain below the threshold for diabetes diagnosis. Although prediabetes is reversible through lifestyle modifications such as dietary adjustments and increased physical activity, it heightens the risk of developing type 2 diabetes, as well as cardiovascular ailments and strokes. Signs of prediabetes often remain elusive until blood tests reveal elevated glucose levels. Risk factors for prediabetes include excess weight or obesity, a sedentary lifestyle, a family history of diabetes, a background of high cholesterol, hypertension, heart disease, or stroke, and conditions like polycystic ovary syndrome, PCOS. Certain demographic groups, including African Americans, Native Hawaiians, Alaska Natives, American Natives, Asian Americans, Hispanics, Latinos, Pacific Islanders, and individuals aged 45 or older, are more susceptible to prediabetes. Stage 3. Full-fledged type 2 diabetes. Type 2 diabetes manifests when blood glucose levels reach a critical and perilous range. Normal fasting blood sugar levels should register at 99 mg of sugar per deciliters of blood, milligram per deciliter, or lower. Prediabetes is characterized by blood glucose levels ranging from 100 to 125 mg per deciliter, while values surpassing 126 mg per deciliter signify the presence of type 2 diabetes. Symptoms of type 2 diabetes may vary, with some individuals exhibiting no overt signs, while others experience mild symptoms that progressively intensify. Common symptoms include increased thirst and urination, blurred vision, heightened appetite, numbness or tingling in the extremities, peripheral neuropathy, and delayed or non-healing wounds, diabetic ulcers. Indications of uncontrolled blood sugar. Even when adhering to a prescribed diabetes management plan, blood sugar levels can fluctuate due to the condition's gradual progression. If you observe signs of your blood sugar veering outside the normal range, it is imperative to promptly contact your healthcare provider to discuss necessary adjustments to your treatment regimen. Stage 4. Type 2 diabetes accompanied by vascular complications. The final phase of type 2 diabetes is characterized by vascular damage affecting blood vessels. This encompasses conditions such as diabetic retinopathy, atherosclerosis, and diabetic nephropathy, which result from prolonged exposure to elevated blood sugar levels. These complications entail reduced life expectancy, vision impairment, and end-stage renal disease in individuals with type 2 diabetes. Diabetic retinopathy involves swelling of blood vessels in the eye, leading to fluid leakage, which can result in vision loss, retinal detachment, glaucoma, and cataracts. Atherosclerosis encompasses the accumulation of plaque, fat and cholesterol, in arteries, which eventually hardens, restricting blood flow. This condition can culminate in heart attacks or strokes. Diabetic nephropathy results from kidney damage due to high blood sugar, impairing the kidney's ability to eliminate waste and fluid effectively. This often progresses to kidney failure, necessitating regular dialysis until a kidney transplant becomes feasible. Slowing disease progression. The most effective approach to stave off or decelerate the advancement of type 2 diabetes is vigilant blood sugar control. If you receive a diagnosis of insulin resistance or prediabetes, adopting a healthy lifestyle, encompassing a balanced diet, regular exercise, and, when indicated, diabetes medications, can forestall the development of type 2 diabetes. Recognizing that type 2 diabetes is an evolving ailment that poses increasing challenges in blood sugar management over time, collaboration with healthcare providers is vital for adapting treatment plans and medications to avert severe complications. In summary, although a diagnosis of type 2 diabetes may appear sudden, the underlying bodily changes commence years in advance of such a diagnosis. Diabetes unfolds across 4 stages: insulin resistance, prediabetes, type 2 diabetes, and type 2 diabetes complicated by vascular issues. Elevated risk factors include age exceeding 45, a familial history of diabetes, a sedentary lifestyle, and excess weight. Early detection of insulin resistance or prediabetes allows for the adoption of lifestyle adjustments, including dietary improvements, increased physical activity, and, where necessary, diabetes medication, which can deter the progression to type 2 diabetes. Effective blood sugar management is pivotal in averting grave complications such as eye disorders, kidney impairment, and cardiovascular diseases. Although some individuals may achieve type 2 diabetes reversal, for many, it remains a lifelong medical condition. A final note. A diagnosis of any form of diabetes or insulin resistance can be startling. Making substantial alterations to dietary habits and daily routines may seem daunting, but with the guidance of healthcare professionals, it is possible to devise a tailored treatment strategy. Maintaining blood sugar within the normal range significantly reduces the risk of severe diabetes-related complications. As always, discuss any concerns or the need for modifications to your treatment plan with your healthcare provider.